So many couples want to become parents, but for many people, complications can make conception much more difficult than they'd like. So here to answer true or false questions about fertility and fertility treatments is Dr. Karen Boyle, who joins me from Baltimore. Welcome back to the show, Dr. Boyle.
Thanks, Tanya.
So we have 6 true or false statements for you. We're going to get right to it. The first one is a classic. Tight underwear affects a man's fertility. Now, this is the age-old question, boxers or briefs, does it really matter?
Exactly. Well, the decision, boxers versus briefs, really is the man's, and the concern should not be there. You know, the idea is that briefs might be too tight and might cause temperature elevation in the testicles, but this is not true. And basically, the man can choose, and the temperature does not get high enough in the testicles with briefs like you might imagine with a hot tub or something like that. So it's the man's choice, boxers, briefs, just fine.
So the underwear doesn't matter, but you might want to stay out of the hot tub.
Stay out of the hot tub,
right?
Exactly.
All right, next up. You should have sex on day 14 of your cycle if you want to get pregnant. You say this one isn't exactly true or false, right?
Right. The idea is this, that if our bodies read the textbook, that's absolutely true. You know, day 14, day 15 is the day that most women should ovulate, but our bodies don't know the textbook. And so the most important thing for a woman is to monitor her ovulation and find out exactly when she is ovulating and have intercourse around that time. So counting out to day 14 isn't enough because a large majority of women might actually be missing their ovulation day.
All right, that's very important to keep in mind, and it's kind of related to the next one, which is, I think, one that a lot of people may be surprised to hear. You should have sex 24 to 72 hours after you ovulate. True or false?
Well, again, this is a maybe. I would say yes, but don't rely on just that one episode of sex. And the reason for that is that you often get pregnant from the sperm that are deposited before you ovulate. So I advise patients start having intercourse 3 to 5 days before you suspect ovulation to occur through about 3 to 5 days afterwards. That way, not to make it sound too programmed, but you're hitting that egg with as many sperm as you can. To rely upon just one episode of intercourse 24 to 72 hours later isn't enough because remember there's a very, very small window after ovulation that you can get pregnant. So you want sperm there beforehand as well.
And how long can the sperm stay alive?
They can actually stay alive in the vagina, uterus for about 2 to 3 days. So that's why having intercourse starting, you know, a few days before ovulation, those sperm are still going to be alive,
right,
and can cause a pregnancy to occur.
They still have a fighting chance. All right, Dr. Boyle.
They absolutely do.
Here's one that keeps a lot of people from seeking help. A doctor won't see you for treatment until you've been trying to get pregnant for 1 full year. Is that true or false?
This is false. So the first thing I'll say is if you have regular periods and you don't have anything on history as a man or woman that's concerning, and you're in your 20s as a woman, then that's true. You know, you should try for about a year, do timed intercourse, monitor your ovulation. If you have anything in history or anything that shows that maybe you're not ovulating normally, you've been doing predictor kits and they're not working, your cycles aren't regular, or you're over 35 as a woman, then give yourself 6 months because we don't want you to wait a year. We don't want you to waste valuable fertility time trying if there's something underlying going on.
So doctors will see you, and if for any reason someone is not seeing you, just pick another doctor.
Very true, yes.
All right. Okay, here's another one about ovulation. You should have sex as many times as you can on the day you think you are ovulating. Now, some may think that increasing the frequency may help their chances, but you say not so fast.
No, it sounds like a good idea. It may be fun and enjoyable, but from a fertility perspective, that's not going to optimize your chances. And the reason for this is that it takes about a day or two for men to build up their sperm reserve. So if you have intercourse every day or multiple times a day, even men that have normal sperm counts will have falsely low sperm counts, and that will reduce fertility chances. So again, on the day of ovulation is fine, but it's more important to be regularly having intercourse around ovulation every other day so that sperm counts remain normal and you optimize your fertility.
Right. Now, all of this talk about ovulation and timing and all of this can cause a lot of stress. So finally, true or false, does this stress cause infertility?
Absolutely, absolutely. And it doesn't help when men and women are having problems already conceiving and it's adding to the problem. So it's easier said than done, and I realize this, but it's important to try to keep romance in your relationship, have dates, and not make this a science project. Still enjoy your partner, realizing that the most you can do is monitor your ovulation, know when you think you're ovulating, start having intercourse at regular intervals, and don't worry about it until you're trying for 6 or 12 months, depending upon your age, and then seek help. But don't overthink it. Don't overstress it, because it's going to potentially cause problems of ovulation for women. Just having stress could cause problems of ovulation. And for men, men will have performance anxiety sometimes when they're trying so hard to perform on demand at the time that egg is being released. So try to relax as best you can and enjoy the process.
Don't cut out the fun and the romance. Dr. Karen Boyle, thank you so much for being with us today.
Thanks, Tanya.
And for more great health news and information that's good to know, check out the health page at abcnews.com.
ABC News Now, good to know.